From gym memberships to nutritional supplements to organic produce, many Americans spend a lot of money to stay healthy, and that includes physician visits. According to the CDC, we headed to the doctor's office 964 million times in 2006. Yet, even though the United States spends twice as much on health care as other developed nations, many say our quality of care is lower thanks to a broken healthcare system.
Our healthcare costs are 17% of our GDP. That's $1 out of every $6 goes into healthcare. The countries we compete with, it's 10% of GDP. Healthcare costs are killing the global competitiveness of the United States, and the quality of care is very, very erratic. And 50 million without health insurance. What a travesty in this rich country with all this money going into healthcare.
Letting insurance companies dictate care doesn't sit well with many Americans who want more control over their health. Today, a rising number of doctors offer what is called direct practice, sometimes referred to as concierge care. In this new model, patients pay their primary care physicians directly in exchange for more face time during office visits and round-the-clock access to the doctor.
The direct practice movement is an attempt to recapture medical care. It's an attempt on the part of physicians and on patients to get control again of the medical care system. It involves a direct relationship between the doctor and the patient. And as part of that arrangement, the patient controls the payment to the physician. So the money may come from other sources. It could come from the employer, but it comes through the patient, and they decide which physician to employ. That's a revolution in the way medicine is practiced now. It would have been not very exciting 50 years ago, but now in a world which is controlled and run by insurance companies and governments and employer-controlled health plans, this is unique.
Physicians who offer direct practice say that by bypassing the insurance companies, patients have greater power over their care and will in turn receive better service from their doctors.
I'm sure that you have waited too long for an appointment with the physician, waited forever in the waiting room to see the physician, been unable to get the physician on the telephone. In direct practice, in general, these things disappear. So service is much more patient-focused because of that relationship. It's going to lead, for the first time, to competition between physicians for patients. It's then going to force doctors to compete on quality, which will have to be measured and published, on quality in terms of the service that the patient gets, and on cost. And over time, we expect that actual medical outcomes, that quality of care can be better. This is something which people are now starting to try to measure. It has not been shown yet, but we believe it will be there.
Yet direct practice has its critics. Some industry insiders argue that it could potentially drive up healthcare costs by doctors who order unnecessary tests to please demanding patients. Plus, they fear it limits access to care for patients who can't afford the fees direct practice commands. Proponents of direct practice say it's up to the physicians to address these concerns.
The critics of direct practice level several charges at the movement, and probably the most important one is that direct practice, they say, is an elitist phenomenon which takes care of the wealthy and ignores the poor. And it turns out that that's just not true. There are some very interesting models which are being developed to use the principles of direct practice to take care of people who cannot afford health insurance under the current system.
The critical thing about this is that it operates on many different economic levels. Initially, the first practices were very expensive practices. And then as time went on, new markets evolved for middle class and now for uninsured patients. We can provide not only low-cost care, but we can begin to provide care for uninsured people who can readily afford our fee and for whom right now the only option is the emergency room, which is an enormously expensive thing to do. So doctors and patients love it. Insurance companies will someday come to love it, I think. when they realize that they're back in the insurance business, which they're good at, and out of the medical management business, which they are terrible at.
As our healthcare industry strains under the weight of high costs, some solutions like direct practice will help reshape our broken system.
This movement of direct practice, this disconnects the insurance companies from the consumer and his or her doctor. It's tremendously important. It's not only that you have to overcome these insurance bureaucrats who have the audacity to take your money and then get in your way, but it's also that it takes so long to see doctors. Why do they call the customer a patient? It means you better be patient. I'm busy. Now, when you have direct practice, you and that physician have a direct connection. You're not a patient. You're somebody that they are very cognizant of, both medically and in terms of your personal needs. It's going to be huge.
All Care Medical is one of a small but growing group of medical practices offering direct practice. Led by Dr. John Levinson, All Care Medical's direct practice model allows doctors to spend more time with each patient, delivering a higher level of care.
Most direct practices have 300 to 600 patients or sometimes more. I'm more like 50. So with this tiny group of patients, I'm able to give really exquisitely tuned care to those people, which I really enjoy. But frankly, because they're also paying money to me on an annual basis, I'm allowed to keep my regular cardiac practice open to all people regardless of their ability to pay, and I'm able to spend more time with each patient than I ever did in the past.
Located in the heart of Boston, the staff at All Care Medical offer the personalized service made impossible under traditional managed care.
Since I started my direct practice, All Care, about 7 years ago, it has made an enormous difference in my relationships with my patients. I have more time with every single patient, and I know that they have enjoyed a more relaxed me and a better office visit, and frankly, easier access to the office.
As health-savvy patients demand better service from their physicians, direct care practices like All Care Medical will surely gain in popularity.
Since I started my concierge practice, All Care, about 7 years ago, it has grown more than I expected. And what's happened, which I did not anticipate, is that my practice has grown to be independent of geography. I have now a substantial minority of patients who have no home in New England. This, when I noticed it happening, became pretty exciting. And now I'm growing this practice, looking actually for patients who are not New England people, but who want to have the very best medical care that they can have anywhere. And as that has happened, I have 2 new physicians who are joining, both extraordinarily trained physicians at the same kinds of hospitals here in New England, who will help me to make this real.
For more information about direct practice, visit allcareboston.com.